Welcome to Foods TV. Tubatangira muno ba viewers baitu. It's a Friday morning program Free Talk. Studios amabara tugonza NAUME candidate ndinye nkanye no msawa waitu Dr. Frederick. You're most welcome, Dr. Frederick.
Thank you, NAUME.
So, ekiro kya lero tubaleteire, we are going to talk about ulcers. Obulwaire obukuse ekintu kale kikusinga condition ekusinga muno kutalibanza abantu bayingi kandi omuntu wene yakusobola kufuna daktari waito omukugu Frederick ajja kuba nayongera kutugambira. Dr. Frederick, ulcers zino what exactly tuikara ntuhura ulcers inkarwara ulcers but what exactly is it?
Kubanza NAUME webale waito mtekaniza na abantu abakurora 4TV na abakora live stream amawaragange ni nyowe mteki Frederick Innocent adiri msaija mugweri ndi mutoro aningoza kusima 4TV tutakatandikire abo kutuhereza omugisa guno kukora health information dissemination kwikalinyo abantu enyo nsonga nkuru muno then TV yenu yaitu hantoro ni kitukwataho muno kumekinga sure ngo TV yenu yagenda amayanja kugaruka ha murama gwetu gwa kerokino ogwa ulcers ikigambo ulcer nikimanise kihoya NAUME
kihoya
baitu hoya tebikusana ne kikubireta kikusana ulcers in quotes is abantu bakumanya rundi peptic ulcer disease rundi gastritis burwaire bufokere common muno actually saa zino ha population ya abantu katwazeo Hartford potro abantu recent statistics are USAID is like out of 100% of the population almost 77% of the population of people have a bacteria that cause ulcers. Ekikaguzo kyao kiwere nkigamba ulcers hizo kiki. Ulcers bihoya byomunda. Ebihoya obicho kansanjo na musanjo bya bihoya binu birete wakahuka ka bacteria. Kauka kataito tokarora kal microscopic. Aro tests mwirware zibakore zikoleka musagama ngukaini abantu nsanju na musanju bano abantu abiri na basatu % 23% of the population of 77 baina kahuka ka H pylori baitutibane ulcers.
H pylori baitutibane ulcers kandi kauka niko kakuleta ulcers.
Kauka niko kakuleta ulcers.
Ateke nikija kitanja kahuka inako but taita familia ulcers. Ekyo kubanza nokubanza oito mutekaniza ekitusemerire kumaya ngo burwaire bunu kujya kurora umuntu yafuna active disease haro factors inkaina eyo kubanza risk factors no sobora kubaka huko kaine waitu risk factors tokuzigenda muno nazo tujya kuzibaza mu maiso kuboranyikiriza no sobora kuboina akahuka kan waitu immunity strong immunity tukira muno gibaza program hano which is the ability of the body to fight against infection. So we don't care akakuba umuntu ina strong immunity obuka buno nulema akora active disease abokuba every time obukuba waja kwikainochula msaize yo kuleta obroire abasurukale babo mbirimba bukeshi. So it is also immune dependent. So umuntu bakuba ina immunosuppression na kafuna kurugira mu ulcers chances ziba high good
nyingi wale kunyetegereza ensonga ya endi is inachula msaizi obuka muno obuka no sobora kububwine betu kwika level yo kuleta obroire so they cannot reach the virulence levels
atebo gumani bweyongera obwingi rundi asanga ina that amount of obuhuko obwo mubiri oba bwo bwenyini bugenda ni bukura ni bukanya
ekyo kubanza n'okubanza waitu mutekaniza ekitwine kumanya itwe nk'abantu abakora for TV ngo mu bubiri bw'omuntu haba mu buhuko bwikaramu obubeta NAUME flora nibwikarayo mundu uko tubukuleta burwaire bwinayo omugaso the probiotics buyamba omubiri gwawo kukora kurungi baitu obuhuka bunu bwenyini obu NAUME flora kakube embera zihinduka twabazaho immunity twabazaho inoculum size twabazaho na risk factors obuzikweyongera obuhuka bunu hati nibuletake
nabo bukwani bayongera inoculum
exactly inoculum kimaisa group yabo wekweyongera kimaisa na man nago ningakoraki
nago
nigeyongera
atikike kikusa kuongereza obuhuka buno bwingi
risk factors
eburugamu nomo ranges zikagaruka mu abnormal kandi kujya kuturwaza ulcers
ekyo kubanza no kubanza muno hano footpot is alcohol obo kunywa amaro maingi one nigga suppressing immunity but two it exposes you to ubuhuka bwa H pylori bunu kukanya
nabo
but also
nigga kanyiso obuhuka
amaro agasobora kutakanyisa obuhuka such but haro muhanda gundi ubwo muntu asobora kutungira mu ulcers ogutabalizeyo natural omuntu munda ya agera acid omugaso gwa acid yenu hydrochloric acid yokwita obuhuka obujana ebyokulya obukulya omuyembe utagwogeze yarumu akahuka se akahuka kakuleta typhoid salmonella typhi the first line of defense omubiri gwawo gwine kwerwanaho hugwenko omubiri so the first line of defense
so
acid egine ekyobuhuko baitu haro possibility ngo omubiri gundi gusobora kusecretinga acid yenu kandi obuhuka butaro kandi otaine na byokulya munda
gwani guturuka acid kyonka tare byokulya birimo obuhuka byokwokya
so acid yenu netandika kulya ebisika byenda yabo
okay so muntu inaguma nalya niko acid nefune kyo ingesting
not gamba kwikara nalya ohira okwerinda acid yenu eteja kukorekita semerire kubaho wano yetegereza
no behavior okuri
naturally omubiri obwongo bwine biological clock on-thing cycle, sleep and awake full cycle, eating cycle. Your body is programmed to eat at a certain point. Of course, this is trained. You cannot get training at this point. I'm supposed to eat something. So natural omubiri ngoma yazira ikasa mukaga. Naye ninja kuba nindeta acid yenu.
So na acid ne kare yetegekere.
Very good.
Then neguleta acid ne kare available.
Then there are also actions that trigger secretion of this acid. For instance, people who you are chewing.
Okay.
Natural okuba no chewing obongo bwamba mutekereza someone is eating something.
So
but you now in this case you are chewing marijuana. You are chewing mairungi. You are chewing PK. But you are not putting anything in your stomach. So the acid will come. The vagus nerve will be triggered and the acid will what? The chewing mechanism triggers secretion of what?
That acid.
It's so kutagenda yo pathophysiology. But to acid owe kuija kandi kawabanoli akandi. So you find there is nothing. Okay? So acid.
So once there is nothing netandika kulya bisika.
Netandika kusika binda yao.
Bweka kubilya nofune bihoya hoya.
Nofune bihoya. Ulcerations munda yao. So that is one of the risk factors. So alcohol nayo nihe kuizira aho. Obo kunywa amaro maingi. First, alcohol itself suppresses your immunity. Second, hiyo alcohol it triggers excessive secretion of acid. And
omuntu bwakunywa alcohol acid nyingi eri secreted.
Exactly.
How
pathophysiology ya alcohol na acid. For the record we should know is ekyokubanza ngo amaro agano gal absorb nbichweka bibiri munda. Haro ekiende kikumalirayo nebisika byenda yao. Those are the only two places that secrete acid. So an alcohol enu aroho vitamin yegiyamba kuba absorbed mbisika byenda yawe amba geta vitamin B12. That is why abantu bona abakera abine alcohol symptoms waninkes encephalopathy waninkes syndrome tukera muno kubahereza vitamin B12. So alcohol triggers secretion of acid abokuba obwekuba nyingi vitamin B12 nehwao so it is not absorbed. And then some alcohols themselves are converted to acid in the stomach through metabolism.
Again, that very kind of acid.
Not the very kind.
Not the very kind form of acid.
Not the very kind of acid, but an acid in metabolism. You know that alcohols have a pathway of being converted to what? Acid.
So they have their own acid.
They have also their own, but it doesn't matter which own acid. Here sobora kutaba nkeri, but it still causes the ulcerations in the what? In the stomach. But if you can sanju na msanju bia ulcers abantu nibiletewa akahuka ka bacteria kawakweta H. pylori, Helicobacter pylori. So akahuka kano ukakuija kakakolonizing ebisika byenda yawo nikaleta ehoya bya ulcers. Haro risk factors ezindi. For instance, abantu abakurwara obulwaire bwa HIV. So you are on prolonged drugs. Mwikara nomine miwazi ya ARVs.
Drugs ezimuzo zonkanzo zikuleta that ulceration.
Haro ne miwazi y'obusasi. Ibuprofen, pyroxcam. Emibazi enu diclofenac. Emibazi enu pathway yayo yokwiha obusasi. Mu pathway omubazi okukuba nokukora kwiha obusasi.
Handa gwekurabamu.
Aro mu pathway omuhenyini it also increases secretion of acid in the stomach. So bokumera for a long time. We're increasing excessive secretion of acid, so they expose you to
so it ends up eating up the walls.
That is one of the side effects of a drug. It won't go to kutamba usasi, but to kutamba usasi nugongera
nuguleta na secretion ya acid. So wekuhingura na muno nebisika byenda.
Taking a lot of time without eating, having irregular eating cycles, the type of food you're eating, when the food is too spicy.
Na type of food. So harabika byokulya bikuletereza ulcers.
Especially byokulya bikuwa birumu oil nyingi.
Yo oil nayo nereta secretion need.
Hat oil egyo nereta a lot of secretion of acid. So owiro kukera spiced foods. They cause secretion of excessive acid. But for in conditions is related na ulcers. Hatinka gastroesophageal reflux disease. Ekiata. Because this acid has become too much in the stomach, it goes upwards. Netandika garukanka mumirugwa. By the way, for your information, the stomach is located around here. So turabantu signs and symptoms za ulcers. Abantu abakukera nibajamba gama basase kifuba.
Na sase kifuba.
Naija mwirwaro na gamba kifuba kyanyita. Nindie byokulya nindiaho ikintu kitaito nimpurende kozereki. Ijuiri.
So what brings about that intia? Nibo yali byokulya baitu na horende
ijuiri. Nimbana na jakulya nimpura na lemwa kulya.
Nabundi nalya na ura naenda kutanaka.
Ale fullness, ale satiety. Excessively gassy abdomen, you keep passing a lot of flutters. Ukwevijagura muno. Kura mukifuba muno hakubaba.
Still haven't haturukayo acid ni abana bayijagura.
Ekyo kubanza
acid eno ni yejuize ndakugira gamba nti bwara kalya hebyo kulya genda kura satiety nyingi.
Hati acid
acid yenu oweko emazire kuba produced omubiri niguleta mechanism yo breaking her down so products of breaking her down acid yenu harumu gas
so enda nesananka ijui
yenda nikarijwira harumu gas nyingi so every time
no
you're going
kuzimba nezimba
most times no kuzimba nezimba ukikwata no hurezimbe tolire bitu no hurende kozereki ijwiri because of the excessive gas. So signs and symptoms are ulcers, that is one of them. But also causes, risk factors are ulcers, stress. Obukubo stressed, no releasing a stress hormones. Stress hormones trigger excessive production of stomach acid.
So the more the stress, the more the hormone nereta na HCl.
Nereta a lot of hydrochloric acid.
Okay.
So when you are overstressed, you're producing cortisol, stress hormone. So eno stress hormone wekuba nyingi mumubiri nereta excessive production of acid.
So I think ekifuba kikuba nikimusasira nkanka.
And risk factor ntakajevero nko tijali ekyo obesity. Trunk obesity. Kunyeta thikirikizu bayawe mwirwari to kunyeta tukigera honsonga yona
no kuhingura ine
kunyeta hands kun it's okay you get your bums,
the hips,
brown thighs, it is okay baitu okunyeta kutande okunyeta kweruguru kun
enda amugongo
ekifu amabere ebichi weight around that doesn't come well.
Kikutalibanza kiti.
Obwiro obukukira nkabanke balizeo some time back we have types of fat. Haro subcutaneous fat, haro serous fat. Ebisajwa binu obwiro obukukira they themselves, especially the subserous fat, secrete certain toxic substances in your blood. Tumor necrosis factors, endocrines, inflammatory cytokines, chemokines, all these ones are secreted into your blood. Then it's so but naturally, certain type of fat which you have when you are obese causes the body to secrete toxic chemical substances. Inflammatory mediators ebikuletera omubiri gwawo gwababuka nagabati
nigubabuka.
So most times ekyo ine kumanya somehow somewhere histamine itself, haro chemical substance mubiri tukweta histamine
egyo yon eba nekora cyo
triggeringa kuletera kufuna allergies. People who call allergies, irritation of the skin.
So your chemical kuletereza allergy.
It also causes, it also has a pathway in causing ulcers munda.
So sometimes omuntu bakuba ina allergy na ulcers akusobora kurugira mnagifuna.
Mazima, it is true. But however, it originates from you being obese. This subserous fat, it actually even forms cholesterol. Cholesterol actually it is very aro cholesterol nungi ye kuyamba umubiri baitu aro cholesterol mbi especially the
nungi netuyambaho
ne kuyamba mu digestion ebyokulya bino ebitulya byona bisemeriye ko absorbed mu mubiri baitu kuba absorbed aro certain chemical substances ezikubiyamba kugenda nabyo kubidirectinga mbere beraji. One of it is cholesterol, but most of it is vitamins. Vitamin B1, vitamin B2, vitamin B3. That's why it is important to eat fruits. Most fruits contain a high level of complex vitamin, fat-soluble vitamins, and water-soluble vitamins. So even cholesterol, even hemoglobin carries oxygen. Because if we don't have this hemoglobin,
nkiwankimaisa oxygen tukucha, there is no way it will be carried to the what? To the tissues. So similarly, high density lipoproteins, they are responsible for carrying certain chemical substances which are important in the body. Baitu okutagire hona ngo muntu obako bali obese ebisajwa bino nebisecretinga toxic chemical substances nizija musagama yao. These ones do not only cause ulcers, they predispose you to diabetes, they predispose you to hypertension, high blood pressure. But in this case, we are talking about ulcers. So research in Negambangu, 33% of the ulcers that we have right now are caused by obesity. Our population is obese.
Due to those toxins.
Due to those toxins. So drugs, obesity, even these natural drugs that you people keep chewing, at these days I don't like smoking. Cigarette smoking is very dangerous. At these days we no longer smoke. There is a classic way of smoking called shisha. I talk about it on every time I come on TV. It is not cool.
How does it bring about ulcers?
Because now you see, every time you go to a club to relax, you find beautiful ladies putting these pipes of smoke in their lungs. These things have nicotine.
So nicotine, you know.
Yes, it actually nicotine it has been discovered to be a precursor in cancer. And even those flavors they put in those shishas that people are smoking. True. Turaja kudiscussing our complications za ulcers. Owiro bukire bihoya nebidubuka. Abo kubenda enda nesana balloon eri mukifuba kyawo hakaimeme. Omugaso gwayo kutangire byokulya bikuruga mu kanwa kuraba mu miro kujja munda. Kumura asidi ekyobuko burumu nko byokulya bikagumizamu bikeyongerayo. Haro na digestive enzymes ezirumu, especially pepsin na renin mbana bato. Okay? So obwiro bukukire ende enu ine layers ine bisika. So ebisika byenda binu bisika bisatu no bimanya. So ebisika byenda binu sometimes ebihoya ni birya bikidubura.
So ekusobora kulya leya yo kubanza kisika kyo kubanza kagaruka kisiba kya kabiri.
Ekalya ne yakasatu. Then you get a perforation.
Nibifumuka.
So we have this complication, perforated PUD. It is a medical emergency. Bleeding PUD ebihoya ni biju. Ogenda kuihayo bubi aheru no hayo bubi bwa black. Esagama era very bad digesting. Around sometimes no tanake sagama.
Now saga
kurungi muno. You vomit and you vomit blood. Why you have wounds in there? Hematemesis. Vomiting blood. Frank blood. Bleeding PUD. So these are medical emergencies. Umuntu na losing sagama. Someone becomes anemic. Turaja kubaza tests osemerire kukora mu irwaro borabo tungera ulcers. One of them is a CBC. Find out why someone is anemic.
Bleeding.
Actually, to some extent, because of anemia, someone even gets palpitation. Especially these young girls. Someone na kutekerezisa ngo mtima kozereki.
Ulcers.
It is just ulcers. Chest pain, palpitation, mtima ngwehuba, nazgor, amani some takulia, buli kyakulya na kitanaka akanwa nikasara. These ones are all signs of ulcers. Yes. Constipation.
Acid kuba niyo nejane kasalisa orundi.
Exactly. Kanwa nkafurunguka because gastric contents are going upwards. Some of these people even have bile reflux. So actually bile ndurui. Mbaso gwenduro gwa kudigesting ebisaju.
So it goes back to the obesity thing when you have
so
excessive fat in the
endo
body.
reason ziba zita omuntu bwakuba ina ulcers ingrain
Enduro hizo zisobora kuba zitali related na ulcers, but to be honest it is a complex thing under obesity. So omuntu bwakuba ali obese is likely to come up with all these symptoms, not only because they have ulcers, but they have other infections related to what? To ulcers.
they are hand in hand.
So to our causes and risk factors. Risk factors: going too many hours without eating, HIV infection, being long on a certain drug, misusing drugs,
chewing,
excessive
and you're
chewing,
not putting in,
anything
you're not taking
inside.
in, but you're just chewing.
Very important.
The tobacco, okunywa etaaba.
You are taking 2 liters of beer every day. Taking beer is not a problem, but excessive taking of beer. Those are risk factors. Staying long without eating. People who don't do exercise. You are living a life that is very sedentary. You are always sleeping. You are watching movies.
Ati boku Carol inactive ulcers zikuja ziti.
You become obese.
You become obese. Oversleeping, guma olya otalina kyokora.
And what you should also know, wait omutekaniza ngo omuntu owakuba ali at rest. Aro hormones ez'omubiri kusecretinga. And these hormones want to maintain you at rest. It is not good for your body to stay in the parasympathetic nervous state.
State yoli inactive, toina kyokora olyaho byamire rundo ikalire, just wikalire.
You are sedentary.
So on average hours zingaze toina kuba inactive.
Isobora kuba zitali medically documented, but to each person at least should train for 2 to 3 hours. 2 to 3 hours for 2 days. 2 days only in 1 week. And it is also becoming hard for us. So at the end of the day, complication in ulcers, someone develops gastric cancer, hepatocellular carcinoma.
How does that cancer come about?
Perforation. Hata kyone kuma yangu obuhakubaho kubabuka ku mubiri for a long time. Tissue ye kuberoho ne induka ne foka tissue ndi. Cells rundi obutafali bumubiri okuba bulo at that time no buhinduka.
Ati iyo leya yokubanza acid bwe kulya leya yenda yokubanza. Ya kabiri there is no way yokusobola kuba replaced. Ngo kufuna nkawundu hano olususu lwange lukarugaho. Then again akamero rundi even if it is a fingernail karuga norore ya kabiri kuziri. So there is no way any layer yokubanza we kuba eaten up by that acid. Bisahende kusobola ku replacinga rundi bungufuna treatment layer kusobola garukaho ne garuka ne yazimba.
Kubanza no kubanza treatment yero.
So treatment egyo ekihoya ne kijanjaba ne stopping a perforation already eririwe.
It depends on the extent of the disease. But to also healing or healing by fibrosis. Healing by fibrosis in kimaisa ngo muntu obwakukira nhajahe enkojo. And enkojo is not normal gastric epithelium.
So enkojo kuli omunda nkezi tufuna harususu. Tiziri nizo zimu zetu kufuna kuli omunda.
Nango it is the same.
It is the same.
Gastric strictures. Enkojo nezimba, some of them become hypertrophied. But what is important is kumanya nayo omuhulirizo wali aheru. So kufuna
treatment negaruka ne yombeka. As long as it is timely.
Nikiona wanimba zao. Waito omuhulirizo wali aheru. Enda efisika byenda be lined by a certain type of epithelium. Epithelium nikimaisa skin yerimunda like to get a skin, it is not a skin. But to ekisusu ekirimunda kiri specific ruhanga kakitayo kiri specific
tikiri nicho nkakini
tikiri nicho nakati actually epithelium eyo ine mukanu ne epithelium eyo ine mumubiri mumiro tibikusana epithelium eyo ine mumiro ne epithelium eyo ine munda tibikusana epithelium eyo ine munda is adapted to absorb and to secrete kuleta acid no ku absorbing some components so it is most times a stratified non-keratinized epithelium hati obokutunga ulcers zikamara obwiro tazijanjabire zikafoka bihoya ebihoya bikafoka bingi ebihoya bino bikubambikira tibikusiga nko kuwalioli nangu nibisigaye enkojo
Enkojo telinke za buli kilo zino.
Enkojo it is a structure munda enkojo zino zo kutunga mubiri hano. Wera wagambere epithelium tekusana neno enkojo eno so kutasana neri. But you actually get these structures munda because of healing by what? By fibrosis. So at the end of the day epithelium ene hindukire. Kanda hato bakongera hakaba episode endi ya ulcers. Nikimanyisa ngolio no predisposing to cancer.
Episode endi ulcers zirire leya ya kabiri zikira leya ya kabiri.
Wagijanja yakira ya foka fibrotic. Kiwangimanyisa no butache inenda nkende yeri nomo. So with continuous inflammation, by the way, ikyo inakumaya wetu mtekaniza one of the causes of cancer, cancer physiology. Ngu kubabuka kubaho for a long time, cells nizihinduka. Because these cells have to adapt to this inflammation. So cells change.
Nizihinduka nizifoka
zitandika
kusafari.
Obutafali bwo mubiri obwali mbu multiplying 10 hati mtanga kukora 20.
Bakora 20 nikiba kingura ino mubiri
abokuba hati nkibankimasa waja kufuna tissue yebereta kozere yebereta rohe nkoto because if they were kandi takwetagisa so any excessive tissue is the cancerous tissue. You get so one of the most common complications are ulcers. Most common complication is perforation. And abantu abakukira surviving a perforation akube esagamo we kujwe kagenda peritoneum, you're most likely to die. Anemia, chronic anemia, someone has a chronic anemia because they have bleeding PUD munda. That is a very big complication. But the most common complication is cancer.
So omuntu signs ziri tuzirozereza na sase kifuba na rundi kutanaka rundi puliao katito na hura na iguta akuba na confirming atanti zo ziri ulcers, it's not something else.
Not something else. That is a very good question. Waitu omuhulirizo wale ahero akora for TV. Kutandika na kiro kino bora abantu hura oine signs zo mutekaniza yabazaho kusase kifuba hakaimeme kurenda nijura utakalire rundi obukubulira kokuri akataito kuro umutima ngo kutera enda kusasa kuturuka sometimes kutanaka obukutanaka sometimes mu bintu byotanakire harumu esagama kuihayo obubi burumu esagama zino signs za ulcers.
Chiata
kutunga ekiata tunga ekiata nurege tukikubaba mu miromu
ata obukwano kikubaba ne acid netemba
acid. So
kwebajagura kuona it is acid or
no kwebijagura kuona tukule acid. Kwebijagura by the way is a natural reflex. It is a natural reflex.
Ate ya okaineta neri yogambire gadi.
Gastroesophageal reflux disease here in itself, it is another topic independent of ulcers. But they are intertwined abokuba gastroesophageal reflux disease
nikimanyisa contents za zenda kugarukire ruguru kandi obwiro bukera nikirete bukubone bihoya mu
ebyolire byona
especially most times not that bire ebyolire byona but acid we kutandika ku refluxing negarukanganka
teba ulcers
obwiro bukera nikirete bukubone ulcers so symptoms zino
sobora kuletereza iki
ulcers niyo kukera muno kukireta ekyo kakienda abo kikumi so oborabo ine symptoms zino esto abazaho haro tests ezo sobora kugenda mu irwaro gukora definitive test ya yo kumanya ngo hati omuntu arwire ku ulcers is endoscopy
nira he
hati endoscopy mbakwataka kamera mbakarabya mu kanwa hanfot poto tukakatungire baitu kabarolo hospital iliyo negreta endoscopy so endoscopy mbatekayo kamera munda nehikayo then it confirms sometimes ebihoya sometimes endoscopy no bakubamba gikora mbachwaho nakanyama kateito habisika byenda yawe teriende ende yeri mukifuba mbere byo kulya bebanza so mbachwaha akachweka kakanyama habisika byenda yawe bakatwara mu lab bachekinga warabo ina cancer so ibyo bageta biopsy
barore birabitaka perforating bitake yongeire
ibyo bageta biopsy abo kube bihoya msoko babihoya bitu bihoya bil cancerous so bagitwara bakakora histopathology bakarora cells zao byoma bya microscope bakasanga cells nizezenda yo good to go
so hazo bunkwanta kakozere endoscopy atinga home fort teri mutenka funire nkunda agenda handi
okutubere tugambira umutekaniza ebichweka nsanju na musanju habuli 10 byabantu abakurora ulcers nzirete bakahuka ka H pylori so H pylori ntuno mulingo kutsogiye tegereza ngogine one of them is a blood test it is an antibody test. We test for the antibody of Helicobacter pylori. But we can also do a H pylori breath test.
Breath? No manyota. Omuntu roya rwakwikyawo.
Aha. Tinkwenda genda deep mu physiology enu ukube sobora kutagera omugaso but obwiro bukera H pylori ne secreting a barium. So to testinga tukasanga umuntu ina barium in their breath, we know they have H pylori. And it also it depends on the extent of ulcers. Kuba nyingi kimanza na ulcers nazo ziko.
So still nagenda hairwaro ni bamkoregi test.
These tests can be done here in town. We can also do H pylori in stool. Mubu wao. Muiswa. Akuihahiswa mba checking over avalum H pylori
So H pylori normally it's supposed kuba mubiri obara batagina roha bainayo.
Normally
oba nayo eri part of normal flora nkogambira obuko bukwetagisa nkobubo omunwa oba munda naturally wina kubayo.
Naturally here H pylori tesemerire kubayo. Naturally. It is not listed among the list of normal flora to the best of my knowledge. But most of the people live with H pylori in a symbiotic
ulceration.
Yeah, in a symbiotic relationship. It is benefiting, you are also.
So how do people benefit from the H pylori without it harming them?
Without it harming them. Owiro bukukira bacteria have synergistic effects. Where there is one bacteria, another one is attracted to come. Now H pylori most times is synergistic with lactobacillus.
Lactobacillus. Hali H pylori na lactobacillus.
Likely to be there. Lactobacillus ne kuyamba to aid in digestion. Ne kuyamba to aid in digestion.
So lactobacillus niye kusobora kuletereza H pylori.
Nangu. Galimazima, they are just synergistic.
Where there is lactose, there is
It is not a masting where there is this one must be there, but most times the other one synergizes the other.
So how does it come about when your mobile is removed? H. pylori, is it ingested? Is it?
Yes, it is a natural. In our normal life. First of all, H. pylori is like all the other bacteria. Yeah. So when you eat the H. pylori, it goes in the body and it divides like all the other bacteria. Yeah? And when it reaches inoculum size, it starts causing you what? Gastritis. Yeah.
Okay. Katufunaho ka break katiito. Tujagaruka ntubaza treatment na complications ezindi.
Fort TV. Stay entertained. Fort TV. Stay entertained.
Welcome back from the short break to into so there are some diseases, Dr. Frederick Zororanti Orundi or Jajawola Kabanazo. Hati nona alinazo. Is it hereditary or only yo munta kugifuna just?
Number. H. pylori is an infection, just like HIV, just like malaria.
So teri gambanti family disease.
No, it is not a family disease.
History.
Number. It is not a family. It is not family. It is a joke that someone. That someone thinks of it to rwara ulcers. It is not hereditary. And it is something you get
on your own. Kante kutulira nti
kante kutura ngo nawe
ikalire nona ainayo
ulcers na kutura.
Hati muntu kalabwa kwafunira eno ulcers treatment yakuba nakora atane treating bwarundi. Or it is also a lifetime.
No, it is not a lifetime. But to still now, I always read these journals. 83% of peptic ulcer disease actually is eradicated, especially the H. pylori.
Because most times it for omuntu nagamba bokakurwara ulcers inakwikara no, you have to keep taking drugs.
White omutekaniza treatment eri 3 dimension. Most of the people choose 1 dimension, which is very wrong.
So what are the 3 dimensions?
Obukukira population yetu y'abantu netekereza ngo obujanjabi nuko kuhandikira umubaze ukagenda pharmacy ukagura ukagumera nango. Actually that contributes actually 10% to the treatment.
treatment y'oburwaire bwona eri nutritional and exercise.
Ulcers are nutritional and exercise. So how do we nutritionally treat ulcers? Tukoleseze tutya ebyendya.
Let me first ask you a question. Let me first ask you a question. Why do you eat food above Sahina Zekiro and you eat a plate of food which has chicken? Do you have an answer? Why? You are going
pleasure,
to sleep.
Eating chicken.
For
pleasure, for...
But now, have you asked yourself what will this chicken do in my stomach?
While
at Sahina Zekiro?
sleeping.
You see? So it goes back to the way how we are living. Lifestyle adjustment. Why would anyone be eating a heavy meal in the night when they are going to sleep?
So kihuro kitwesere sapa tukiriesa nkazinga.
Ebusawo wiro buli specific ohereho
because most times families azikusinga nizirya Sahina, Sahitano, sapa, you know, and they are going to sleep. Yes.
Hey. Then it is a wrong practice. Hey, habokuba obwiro bukukira oburwaire obukusinga n'oburuga mu ndya yaitu n'enyikara yaitu. Similarly, peptic ulcer disease, round ulcers, niziretebwa ebintu tukwikara nabyo hano. For instance, obukulya ebyokulya, then ebyokulya bino tobihere chance yokuba digested.
So most preferably ebyokulya biba digested during our activities. Omubiri gukuba active nebyokulya niba digested.
Obukuba olire okaimuka okarubata okakora kiri nikiyamba
digestion neba faster.
So lifestyle adjustment. One, ekirobora abantu enda kulya ebyokulya zihingwire Sahina. Take refuges. Take food that has low nutritional content. Ebyokulya ebitakuba absorbed muno. Ebikuoje kienda kyawe. Ebyokulya ebiri in form of fiber. Cabbage is in form of fiber. Ananas is in form of fiber. Apple is expensive zirek but they in form of fiber. Dodo and swig, spinach, readily available food. Enjagi of Jabar. This is food that you can enyanya. No tungu bubis. You cut them in palatable form, small size, and you eat them in the night and you get satisfied. The purpose here is you kuba satisfied. Or the information we are giving you out there, iwe kuiguta kikumanyisa oli posho, oli vitoki. Now the purpose is to fill your stomach. Okay? But now, zikumara kuhingura saa isatu. Nobo utaina activity ende yokuja kukora.
Okay.
Yokuja kuyamba mu digestion yawe. So it is always not good for us to take heavy meals in the night. Especially spiced meals in the night. Snacks. Very dangerous. Chapati. Rolex. Beverages, coffee malt. I'm not saying you shouldn't take these, but take them when you're going to be active. Soda. Someone is taking Crest bitter lemon in the middle of the night. And what are they going to do? To sit down at home and watch TV. So ego lifestyle adjustment is what we should spend our time on. Exercise. Why should you be taking a border? You are 35-year-old female. You are not a kayawe ukwali. No kora mpanga. Honestly, a distance of less than 5 kilometers. Why don't you at least take this border in the morning? Yes, very, very important, by the way.
So exercising
exercise makes you lose weight. Exercise makes your body breathe. Exercise cuts the unnecessary fat. Exercise removes toxic substances from the body. Exercise refreshes your mind. Exercise aids in digestion. I cannot finish the importance of exercise. So all you know in miaka sunetano, you walk. Karwate aka distance yako. You get?
I get.
Yeah. So then when you want to take a beer, don't take this beer in the night when you're going to sleep. Take this beer in the evening, say and then you go and do some activity. Hikamuka, be active. You singora, limira around the house. You get? Yeah. There are gym sessions. We have gyms in Fort Portal. For us, the youth who think we are corporate when we are not. Why don't you go and take what? Why don't you go and take a gym session and do aerobics? It helps your body avoid the unnecessary substances. True. Now, pharmacologically, treating ulcers, tichugumire. Baito kione kumayango emibazi na however much tujukuhereza kujanjaba ulcers. Na ine side effects sayo ngo kemibazi. Side effects nkazi. Ezo tutakazibalizeho. Emibazi ya ulcers eri mu 3-dimensional approach. Iyo kubanza ntubantu enda kuita akahuka ka H pylori. So we are likely to give you antibiotics. But however, ntubantu enda no reducing excessive secretion ya acid munda. So we are going to give you drugs that are going to help us regulate secretion of acid. One of them is histamine. You know the histamine pathway in regulating what? Yeah. So histamine 2 receptor agonists, especially loratadine, desloratadine, ezo tuzihereza abantu kublocking the histamine pathway of producing hydrochloric acid. Histamine this is the allergy chemical responsible to allergy. Naye inamlinge contributing her ulceration secreting HCl. Exactly. Ekuletereza ulceration wekube yongeire muno HCl. So H2 stopping H2 histamine zino nazo nibazikwera her treatment. Nikisigikira level ya acid secretion yangu kwa kubiri. First of all, ekyo kubanza no kubanza mbazi no tagendo kaje guri yonko muntu. Hikamuirwaro. Let the doctor determine that you need this and this treatment. Depending on assessment, physical examination and history taking. So muntu wakuba after taking the time akagenda muirwaro. Bakaikalira bakamuha treatment akusobora kukira. So twabantu kama so atalinka challenge neitu kumanya nti omuntu kastarwara ulcers kimara myaka rundi ulcers tekukira obwiro bukukira tizikukira abokubiyo no mireme bazi kuonga. So twakuhereza antibiotics wazimira aro proton pump inhibitors. Actually nzintusemeria kuziha for more than 8 weeks. Juma babu manyiro bulumu oburo munda omeprazole, ciprazole, rabiprazole. These ones regulate secretion of protons which help in formation of hydrochloric acid and also prevent the formation of the other gas we are talking about. Now there is also an extent to kusanga acid already ineki. So we give you drugs that contain antacids. Syrup is acids, magnesium trisilicate. Nekendeza secretion ya acid. Nekendeza excessive acid yoko. Neutralizing. So doctor, harebyo kulya specifically byokolora nti omuntu wakulya nkabutuhura abakubaza okonti bakantanga kino harebyo kulya bya muntu ulcers ali supposed kulya at all. Now, akulya hiko amazima agali tutusemerire kuregulating. Kirungi in medical practice gamba omuntu otali akintu nangana. So byokulya ongereze bihoya. Ohiraho ebyokulya biro. Ohiraho kubirya in regulated levels and at a certain time. So it goes back to what I was talking about. Orabo in ulcers. Are you doing exercise? No. Are you regulating the type of food you're eating? And when? No. Why are you eating spiced foods in the night? Yes, you can eat these spiced foods in the morning. It is okay because you're going to move and work. Why are you always sedentary? Why is it that for you leave work in bed, after leaving bed, you go to your hardware in town, you watch TV, ruewajo, motoka nija ne kupikinga around the border, you go back home, you eat, sleep, same cycle, month in, year out. Okay? It predisposes you. So no bokuja tukakuhereza emibazi yeno itwagamba nofunaho relief. Emibazi nekora relief nebao for 4 months, 5 months, symptoms zinu zenyine zijakongera zigaruke because you did not take the other 2-dimensional approaches to
nutritional and lifestyle
and lifestyle adjustment
and exercises.
So
from lifestyle
ebyokulya ebiri spiced oborabo in a BMI biomass index very big. It is better ebyokulya ebiri spiced bino wanzo obireke, especially alcohol, pork, ebyokulya ebisikira with a lot of oil, deep fried food, red meat.
Red meat ni era hedge.
Red meat ni enyama ina cholesterol nyingi.
Ate tukumanya tutanti enyama ina cholesterol nyingi. Enyama ya mbuzi ina cholesterol nyingi.
It has a lot of cholesterol.
Then yente.
It does not have a lot of cholesterol, but it has fat. So it is always better nyama no gitaliki.
So kutalika nyama kukendeza cholesterol.
You're eating fiber just. Nyama ugiteka muro. Ugiteka muro ukagitalika. You make it dry. So you're only eating the fiber content, which is very safe. Then alcohol. That is a must for you to regulate, whether you like it or you don't. Because every time you take this alcohol, not in regulation, you are not only predisposing to ulcers, but to kidney disease, a lot of things, impotence.
Na impotence mu alcohol.
Drunkards, it is on record. Drunkards are sexually inert. These guys don't function. How will you function when your thing is not erecting?
So alcohol affects
chronic alcohol.
erections.
Chronic alcohol. The main word here is chronic. So, so there are many things we really can highlight. By to ebyokulya byone bikuletera kugaininga weight. Kyakoire kirungi obereka. Especially tukuligambo obereke, you can eat but not every day.
Around the methods of cooking.
Even method very
you can go for the roasting.
Drying the food.
Steaming.
That's very true. But also your practices you and komuntu. Natural aro abantu abagara. So it is hard to treat these diseases. So I don't know whether we have any other thing we have to discuss. Ningonza kusima muno for TV nienda kuongera no kusaba abantu baitu nikiba kirungi ohulirize information inkenu, especially okubola mulimo a TV ronda simu yawe utasobora genda mwirwaro kuba this is you can pay consultation fee for this, but now we are giving you something that is free. So bora wanoguro ebintu bino bine nikiba kirungi oyiruko heke mwirwaro bakuchekinge bakonfamingire ngo burwere buno bwine iwo waine chronic disease tukusabero omukama kwatireho kire
nabagenzere mu perforation kuri
people who already have gastric cancer, hepatocellular carcinoma. Tukusabira mukama akwate obusasi buke betiwo wataka kitungiri nikiba kirungi ohike mwirwaro funo janja wire ukyariki
nemibaza gimire nkuba muragire atebwa lifestyle modification na nutritional
adjustment. Actually ngo obujanjabi obukukira tere mibazi obujanjabi obukukira is nutritional adjustment and exercise.
True. Exercise is so important nkuturozere ekuyamba okutanga ebindi byona.
Ekyo munyikirize mbarage for now.
Thank you, Dr. Frederick Ebalemuno. Viewers, thank you for following us, YouTube, YoTV, Facebook, Fort TV app. Mwebale muno kutondera program. Fort TV, stay entertained.